I mean, community health workers, for anyone who's not familiar, do a incredibly diverse number of things. And there's, just as someone who has a PhD in this, heaps of really rigorous trials that show that community health workers can ultimately reduce both the level of sickness in a population and the number of deaths, and create kind of a 10-to-1 return on investment, which basically means that for every $1 that you're investing in community health worker programs, you can yield a return of up to $10 through saving lives, creating jobs. And I think a really common misconception is that this is about, like malaria in the Liberian rainforest. And I think that is a dangerous one, because it's not. What's really important to know about community health workers is that they're often the first line of defense against emerging health threats. So if you think about, things like Ebola or COVID, so often, the first symptom is something like a fever or something that you would go to a community health worker to recognize. And basically, when we are leaving community health workers unsalaried, unskilled, unsupplied, we're not just, we're basically endangering children in every country, because we have this kind of global early warning sign for pandemics that we're effectively leaving unplugged. So I think maybe you've never heard of community health workers, but ultimately, if they're left out in the cold, it's your health that's at risk. So this is, something that really affects all of us, whether or not we might be aware of it.